Hello, welcome, and thank you for joining me on this on-demand webinar info session regarding Doctor of Physical Therapy admissions for the University of Arkansas for Medical Sciences. I am Dr. Jennifer Vincenzo. I'm an associate professor and chair of admissions at the University of Arkansas for Medical Sciences in the Department of Physical Therapy. And I'm just going to give a brief but very targeted info session for you all on details of our admissions. So I know it seems really confusing looking at everything all the time, looking at all the different requirements for every university. Just make sure that you really do pay attention to those details, because details are really important, not just in admissions, but in treating patients and in patient safety. So we know that we want a PT who can be many different things and has to be many different things. So you're not just going to be a clinician, you have to be a consultant, an expert, a collaborator, a team member, a community liaison. So it's really important to us at UAMS to have a person and student, an eventual PT and colleague who can be all these things. And we know that this is more than just grades. So as a committee, we really look at many different things with regards to admissions, and I'll go into that in a little bit detail. So it is a doctoral degree, just a reminder. What that means is it's a professional degree. So there are certain standards, ethics, morals, and professional attributes you have to have in order to complete this. You also have to have certain requirements as far as coursework, etc. And all the information is detailed on our website and on PTCAS. So any most up-to-date information will be there. So always refer back to those sites. Deadlines also may change every year. Make sure you refer to the website and PTCAS for the most up-to-date information. This is currently being recorded in July of 2020, and the deadline for this year for PTCAS is September 15th for submission to our program. There are different requirements, so I'm going to go through them. The first one is you do have to complete and submit the GRE. You have to have taken it within 5 years, but there's no minimum required score, unlike many other programs. So just make sure you take it and submit it. It does have to be submitted through ETS or through PTCAS. We don't accept paper copies, so make sure you submit it properly through PTCAS. If you look at our website, it delineates our program code and everything you need to put in. So in order to look at our website, just Google UAMS DPT program and you'll see the information. With regards to GPAs and prerequisites, this is a hard cutoff in that you do have to have a minimum overall prerequisite GPA of at least a 3.0 out of 4.0. But if you repeat a prerequisite course to get a better grade, we count that better grade. So for example, if you got a C in anatomy and you wanted to improve your prereqs and you took it again, you got a B, then we're going to count that B towards your prerequisites, not the C. However, we can't take out the prerequisites you've retaken or any coursework at all out of a cumulative GPA. So just remember that will stay in your cumulative. Now, the reason that a 3.0 is required is because this is a graduate program. And you do have to maintain a 3.0 GPA overall in order to pass the program. And that's common throughout pretty much most graduate programs, be it PT or even not PT. So we want to make sure that you can complete that coursework with that grade before you come in. But not only that, it's really important for you to have this information to be a successful and safe and effective physical therapist. Now, we also require a minimum overall GPA of 3.0 out of 4.0 or your last 60 credit hours GPA being a 3.0 or higher out of 4.0. So for example, let's say you had a really fun time your freshman year in college because you were out and independent for the first time ever and didn't necessarily commit to your coursework. That isn't going to cut you out of getting into PT school. Hopefully, if you were able to do better in the last 60 credit hours, then we'll weigh that more heavily. And we have had many people who were successful in getting into the program, maybe that had a lower GPA than 3.0 overall, but had a higher last 60 credit hours GPA. Prerequisite coursework, some other requirements, 24 of the 33 required hours or 8 courses must be completed by the time of the application submission deadline. What that means is that by September 15th, 2020, you have to have completed at least 8 of the prerequisite courses. So let's say you've completed 7 and in the fall, you're still currently taking 1. Then you don't have the 24 out of 33 or 8 prerequisite courses completed by the time of application. There are some concessions, not with the amount that are completed, but deadlines of years of completion. So all but 2 of the courses must have been completed within 7 years of anticipated date of the entry into the program. For example, if you are applying this cycle and you're going to enter by August of 2021, then you could have technically completed some courses before 2014. Just 2 prerequisite courses could be accepted. Otherwise, the rest have to be completed after 2014. Also, no more than 2 prerequisite courses can be from CLEP or AP credit, but that has to be recognized on the undergraduate or master's granting university official transcript. And it's not considered a GPA because it doesn't transfer over as an actual grade. We do require generally a grade of C or better, for prerequisite courses. The only concessions we make are right now during the time of COVID in the spring semester, summer semester, and potentially fall. We know that some universities are only granting pass-fail rather than actual grades. So we will look at that and accept courses that were done as prereq courses during those times and accept them potentially as pass-fail. Now, it would have to say a pass C or better. It couldn't say pass D because you do have to get a C or better. These are some information on the types of courses we'll accept for each prerequisite. You can see here, and you can read them for yourselves. This is also delineated in our website if you'd like to go back and look at them. Some notes are, we do not require lab courses. So anatomy lab is great. We'd love you to take it, but it isn't actually a requirement, okay? If you take a combined anatomy and physiology, so let me show you here. So if you take this combined anatomy and physiology course, let's say you take anatomy 1 and anatomy 2, then you can count 1 towards anatomy and 1 towards physiology. And we do accept other types as well. Biology, we accept a variety of types of biology. Chemistry, pretty standard, general or specialized, but they do have to be different. So we won't accept 2 chemistry 1 courses. Same with physics. Note that we will accept 1 biomechanics course in lieu of a physics course. So maybe you'll take physics 1 or 2 and we would accept that. But if you had a biomechanics course and your grade was better in that course, then we would accept that as one of your physics courses. We do accept different types of statistics courses, but they have to be taken under these departments. And then psychology, we accept quite a few different courses as well. If you're not sure what type of courses or if yours meet our requirements, go ahead and email us. Right here, you can see it at ptprogram@uamsdpt.org. at uams.edu. Any questions at all you have, feel free to email us. The more information you send us by email, the better we can answer your question. Usually if we're asking you, you're asking us if we'll accept something as a prerequisite course, then we do want to see the course name, the course number, information about it. We want to see as much detail as possible for us to be able to make that decision. So some other admissions requirements beyond grades and types of courses are essays. In the PT-CAS application, you'll be prompted to answer different essay questions. Answer them thoughtfully. We want to know about you. Put the information about you in it. Don't just answer vaguely. Note that you should really pay attention to grammar and spelling. Again, we're talking about detail. We also require a formal resume uploaded to PT-CAS. We recommend that you have potentially your institution or somebody that you work with or know well to review that resume and make sure it really highlights you, your experiences and your uniqueness. You do, in most years, have to have completed a minimum of 60 hours of volunteer or work experience in a variety of physical therapy settings, with at least 20 hours in 2 separate settings. That requirement is waived this year, this 2020-21 year, because of COVID. We understand that some people may not be able to obtain those observation hours. However, we do highly recommend that you do that so that you know what kind of profession you're getting into. It's important to not just go into outpatient therapy. That's what most people are familiar with, but potentially see what a hospital, a rehab center, or another setting are like. If you do get a chance to do these observation hours, make sure you have them uploaded to PT-CAS, and they have to be signed and verified by a physical therapist. We also require a supplementary application to UAMS Health Professions. It does have a $40 fee, and this is part of the application process. So unfortunately, some people, despite being prompted and reminded, don't complete this every year, even if they complete everything else. And then that means their whole application isn't complete. So it's really important for you to make sure you have a checklist of what's required for UAMS and if you have it completed or not. But it is ultimately the applicant's responsibility to complete these. We also require a completed bachelor's degree from an accredited institution by the start of the program. So if you're going to start this year in August, then you'll need to have your bachelor's degree by August. Another requirement we recently added in the last few years was something called the CASPER test. It stands for Computer-Based Assessment for Sampling Personal Characteristics, and it's an online test that you take at home on your computer, which assesses non-cognitive skills and interpersonal characteristics. Basically, not your grades. Again, it's really important to us that somebody not just has adequate grades to be able to show they can obtain the knowledge to be a physical therapist, but that they have other skills such as the ability to collaborate, empathy, ethics, problem solving, and self-awareness, because that's what's going to make them an effective physical therapist and team member. So this is another way we try to further enhance fairness, objectivity, as well as diversity and a holistic process for admissions. You can complete this again, you do it online. The deadlines are listed on the CASPER website. We do have the deadlines on our website as well, and there are very limited test dates. So make sure you check that out and get that done as soon as possible. This year, the last test date is October 29th. So you can't just take the test whenever, you have to schedule to take the test. and you need to register under our university on the Casper website. The cost to take the test for you is $37, and the information comes to us. We also require 2 letters of recommendation. Almost every year, we do require one from a physical therapist. We are waiving that requirement this year because we know some people won't be able to have interaction or observation of a physical therapist, and we don't want people to be disadvantaged because of that. So this year, we're requiring 2 letters of recommendation from these multiple areas here, okay? Any of these areas. You can't have it from these. None from a politician, friend, family member, or teaching assistant, which includes a graduate teaching assistant. So 2 letters of reference from anyone in this category. A word of the wise for letters of reference. You do want to give whoever you're asking to give you these letters time to do it. First, you want to ask them if they'll do it, and give them at least a month if you can. You want to give them information about yourself. So give them a resume, send a paragraph about information about you and what makes you unique, things you've accomplished or overcome, things you do, so that they can include that in that letter. Because although they may know you, they may not know all of those things about you. The more information they include, the better. Now, once you ask them, you put that information in PTCast and it prompts and sends them an email to complete this. So they can complete ranking and then also upload a letter. It is your responsibility, though, to make sure they do this by the deadline. So you need to follow up with them and you need to look in PTCast and make sure they've done this, because ultimately it comes down to you if they haven't done it, and you will have an incomplete application. So this is becoming mature, responsible, and being able to follow up with other people. Again, these things are all part of becoming a physical therapist as well. Apologies. We do consider other factors. So, for example, we consider things not in your academic record. Okay, it's like evidence of exceptional extracurricular achievement. And that can really vary. Extracurricular varies a lot. It may be volunteerism. It may be coaching a team. It may be doing summer camps for kids. Work experience. We know some people don't have the time or the ability to do volunteer extracurricular things, but actually have to work their way through college. So highlight those things about what you did and what you learned in your experience, because every job we have, we can learn and grow from and can take that and improve ourselves, but improve towards our career. Other things we look at are evidence of overcoming social, economic, or physical barriers, or exceptional motivation, maturity, or responsibility. So our students really vary. It could be a very traditional, younger student that had good grades and was able to volunteer, maybe did some mission work, versus a single mom who raised 2 children and is also working full time. So it really varies, and you need to highlight yourself, what you bring to the program, what you bring to the profession, and what makes you unique. We do not review, FYI, any essays, resumes, or letters of recommendation outside of our admissions process. Diversity is very important to us. And we talk about that not just with race, ethnicity, life experience, and many other things. Communication skills. So again, make sure that you're doing a good job in your writing so we know that you can do written communication, which would help if you're working with doctors, patients, or anyone else. We look for leadership, initiative, community service, and accomplishment in different areas. Again, we want to recruit and educate a class and eventually physical therapists who will serve the needs of a diverse patient population. We do provide some extra credit for applicants who have evidence of proficiency in a language other than English. Note, these factors are very important, however, and may enhance your competitiveness, but they are not by themselves sufficient to admit an applicant. Again, you still have to meet those primary admissions requirements of the minimum GPA requirements, as well as other things such as the resume, GRE, Casper, etc. So we're looking at the whole picture. The admissions committee reviews all applicants and considers all aspects of the application to determine who to invite for an interview. Generally, we invite approximately 90 to 100 people for an interview. Out of those, 24 will be invited to come into the class. The interview may be on site or it may be virtual, and that will be updated regularly on our website. The dates of the interview are in the beginning of December every year. They are also updated regularly on our website. If you are offered a position and you do accept, we require a $500 deposit to secure your position. And that does eventually go towards your tuition unless you withdraw and decide you are not going to come to our program, but go to another program, then you do withdraw or forfeit that deposit. We also do have wait lists. The size of that wait list varies. We don't necessarily share where people are in that wait list, but up to 2 weeks about after the interview, you will find out if you are on a wait list, offered a position, or not offered a position for this year. So basically that's the end of this presentation. If you do have any questions, again, please, apologies, contact ptprogram@uams.edu, and we are very prompt in answering your questions. And if we can't answer them, we will find somebody that can, but usually we can. We will be having some other information continuously coming out on our website, so please continue to check that. And we wish you the best of luck in your application process and in your education, especially during these challenging times. Thank you.